Please, you are going to do this again. This time, you are going to follow a specific path. We start from the bony pelvis, look at the muscles, look at any structure around which isn't a muscle, then we look at the blood supply. I think that's what's important here. So I'll be using these two models together with this one. So we start from the bony pelvis. From bony pelvis, the anterior part, let's see, anterior superior iliac spine, anterior inferior iliac spine. So I hope you can all see. Then, still at the anterior part, we look at this pubic tubercle, pubic crest, pubic symphysis, still at the bones. Then we come here, acetabular labrum, then acetabular notch, then here acetabulum or acetabular fossa. Then we come here, ischial tuberosity. Then the pubic tubercle together with the pubic crest form the superior pubic ramus. The inferior pubic ramus is formed here and joins the ischial ramus to form the ischiopubic ramus. Ischial tuberosity again, I've mentioned it already. Then as you are mentioning the bones, this ligament or this membrane, the obturator membrane. Then this is the ilium. The whole thing is the ilium, ischium, and the pelvis. They come together to form the acetabulum. Then as we were moving, we saw the iliac crest. The iliac crest, we saw that this is called tuberculum. It has parts. It has the tuberculum, the outer lip, the intermediate zone, and the inner lip. So we saw part of the iliac crest. Inner lip, intermediate zone, then outer lip, then tuberculum. So that should be all for our bony pelvis, except, okay, now we don't look at this. We saw this L5 vertebrae, intervertebral discs. Then we came here from the sacral promontory. This is our sacral promontory here, the ala of the sacrum. Then since we are here, let's see, this is the anterior sacral foramina. When you go back, posterior sacral foramina. Then this side is our arcuate line. Now when the arcuate line reaches an eminence here, the iliopubic eminence, it transitions to be called the pecten pubis. The pecten pubis. Then this is our pubic symphysis here. Ala of sacrum. Please, are you okay? Intervertebral disc. This is where the iliacus muscle is formed or found. So the ala of the ilium, or yes. Then we come back here. Posterior superior iliac spine, posterior inferior iliac spine, greater sciatic notch, lesser sciatic notch, and here we have our ischial spine, ischial tuberosity here. There's a ligament from this side to this side called the sacrotuberous ligament, from the sacrum to the ischial tuberosity. You can see it here. This ligament. This ligament. So since we are here, let's exhaust everything. We saw that this was the sacral hiatus. This horn-like projections are the sacral conua or conus. Posterior sacral foramina. These are spinous processes. Then this one. This is a crest. Lateral sacral crest. Then I've spoken about this posterior inferior, posterior superior. The iliac crest is spoken about, the greater sciatic. Then obturator foramen. Obturator foramen. The membrane forms. Yes, the membrane covers here, but doesn't cover it completely. It leaves certain spots. Then it forms the obturator canal. That's where the obturator nerve, obturator artery pass. So we see it here. Here. The obturator nerve and the obturator artery, and get to the arterial supply. Look at it. This is coccyx. So you've seen that this is the what? Hiatus, sacral hiatus, and the conus. So we've been able to exhaust everything here to the best of my knowledge. Okay, now we'll look at the pelvimetry. So the pelvimetry from the sacral promontory to the pubic symphysis is a what? C. It starts with C. Who can tell us? Conjoint. The conjoint. So the conjoint is 11.
Conjugate.
Hey, sorry.
Conjugate.
Hey,
Relax.
It's a conjugate. It's a conjugate, and it spans around 11 centimeters. Then from the conjugate, we move to our oblique. The oblique is 12.5, and the oblique spans from this point down here. Please, are you seeing it?
No.
From
Here.
here. Then
Down
use
here.
Use your hand. Yes. Then use use your hand to show the other part. Yeah, you show.
Okay. This is the diagonal.
Yes.
Then the transverse 13
From
13 centimeters. From this side, the arcuate line to this arcuate line, 13 centimeters. So 13 for the transverse, for the conjugate 11 centimeters, then for the diagonal 12.5 centimeters. That brings us to the end of the bony pelvis. So we move to the muscles quickly. Look at this muscle here, the iliacus muscle. This one here, the psoas major. And we said that the iliacus and the psoas major, they join beneath the inguinal ligament to form the iliopsoas muscle. So after looking at these muscles, let's look at the muscle here, which is still the psoas major muscle. And we said that a very special nerve pierces this muscle and runs anterior to it. What's the name of that nerve? Genitofemoral nerve. So the muscles here are called erector spinae muscles. Erector spinae muscles. And three muscles come together to form the erector spinae muscles. So you can see that there's a demarcation here, another demarcation here. So we have 1, 2, 3 muscles. So closest to the spine is the spinalis. Then in the middle here is longissimus. Then here we have what? Iliocostalis. So again, the erector spinae muscles, iliocostalis, longissimus, and spinalis. Now let's move on here. So in the interior part, as we can see, you see we have false pelvis and we have true pelvis. I'm going to read about it, but let's see. So here we find this, and this muscle. So we are going to name them. Let me use this model. Okay, so we start from the superior part. You see these muscles here, the levator ani muscles. There are 3 of them: pubococcygeus, iliococcygeus, and puborectalis. The good news about these muscles is that their names tell us where they come from and where they go to. So this one, which has been cut, is our pubococcygeus. Here, it has not been cut. It runs all the way from the coccyx here to the pubis to coccyx, pubococcygeus. Then the next muscle here is our iliococcygeus. Coccyx, then the ilium. So the muscle is actually running from, this is the coccyx, this is the ilium. So somewhere, please you see it.
So it sits on this
Okay. So the iliococcygeus are puborectalis. So the puborectalis doesn't extend as far as the coccyx. When it gets to the rectum, so this particular muscle, as it moves, when it gets to this structure, the rectum, it takes a U-turn, then comes back to the pubis. So that is all for our levator ani muscles. Again, the levator ani muscles are the pubococcygeus, the iliococcygeus, and the puborectalis. Quickly, let's move on. And coccygeus. Okay, so let's look at the muscles here. So initially I thought this is the obturator internus muscle going to insert on the greater trochanter of the femur. our piriformis also going to insert on the greater trochanter of the femur. In close association with the piriformis muscle is the sciatic nerve. And superior to the piriformis muscle, we have this vessel here, the superior gluteal artery. And inferior to the piriformis muscle, we have our inferior gluteal artery. Now let's move on to the muscles here. So for the muscles here, we have this muscle, the ischiocavenosus muscle, ischiocavenosus. We can see ischiocavenosus here as well. Ischiocavenosus here. Then since I'm here, let's talk about the bulbospongiosus. And this is our perineal membrane. Perineal muscle. Then this superficial transverse perineal muscle. Let's see if we can identify them here. Superficial transverse perineal muscle, or membrane, ischiocavenosus, bulbospongiosus. Here we can see that the muscle has been cut off so that you can appreciate some structures beneath it, or the structures it covers. So we have this structure here called the greater vestibular gland, or the Bartholin's gland, and bulb of vestibule. So I think we've been able to exhaust the muscles here: piriformis, obturator, sciatic nerve, superior gluteal artery, which we'll look at in detail soon, levator ani muscles, bulbospongiosus, then ischiocavenosus, perineal muscle or membrane, then superficial transverse perineal muscle. Thank you. Okay, so we will look at the arteries of the pelvis and perineum. So for our arteries, we know that at L4, the abdominal aorta bifurcates to give two common iliac arteries. So the two common iliac arteries, this is the left common iliac artery you are seeing here. Please take note, this is the female pelvis we are looking at, female. So this is our left common iliac. The left common iliac bifurcates to give an external iliac and an internal iliac. And we know from theory that the external iliac continues, and as it crosses the inguinal ligament, its name changes from external iliac to femoral. Okay, so this is where we should pay attention to the internal iliac. The internal iliac artery, as it descends, gives two divisions: a posterior division and an anterior division. Posterior division and anterior division. Internal iliac, anterior division, posterior division. The posterior division gives rise to three arteries. We have the first artery here, which is the largest of the branches it gives, the superior gluteal artery. Then we have this artery, the lateral sacral artery. Then this artery here, the iliolumbar artery. So from the name, it supplies some parts of the ilium and goes to the lumbar region, iliolumbar artery. Now, we've been able to talk about the posterior branches and its branches, the superior gluteal, the lateral sacral, and the iliolumbar.
The communications.
Then, as you can see, there seem to be some branches here. This is the median sacral, I didn't mention, but this is the median sacral. And these are communicating branches between the median sacral and the lateral sacral. Communicating branches between the median sacral and the lateral sacral. So quickly, let's move on to the anterior division. So we've seen the three branches that the posterior division gives. Let's move on to the anterior division. So, when the anterior division descends, it gives an immediate branch, a first branch. And that is this one we are seeing here. Because of the ureter, we can't really appreciate it's coming from the internal iliac. So this one is our umbilical artery. When we are born, this artery isn't functional. It becomes obliterated and it runs in the medial umbilical fold. So umbilical artery. Then we move down here. This is our obturator artery. The obturator artery continues all the way, passes through the obturator canal, and comes out here. So this is the obturator artery. Now, very close to the obturator artery, there's an artery that seems to pass beneath the ureter. It will eventually come and pass on top of it, or traverse it, or pass anterior to it. This artery here, that's our uterine artery. So from the anterior division, we've been able to identify the umbilical artery, obturator artery, and the uterine artery. Let's move on to the next branch. The next branch is this branch. This is a vaginal artery. This one, vaginal artery. Then still the anterior division going down, it gives a branch again. And this branch is the inferior gluteal artery. The superior one is here. And let's see. Earlier we said that superior and inferior gluteal arteries are in close relationship to the piriformis muscle. The superior gluteal artery passes superior to the piriformis, and the inferior gluteal artery passes inferior to the piriformis muscle. So as the anterior division continues, it gives another branch that goes through this place, and another branch. The branch here is our middle rectal artery, and this one is our internal pudendal artery. I think that should bring us to the end of the arterial supply, but let's quickly go over it again. This one, umbilical artery, obturator artery, and very close to it, passing through the same canal, is the obturator nerve. As we go down, we find our uterine artery, we find our ureter, we find this one here, the vaginal artery, we come here, inferior gluteal artery, internal pudendal artery, and the middle rectal artery. So the white, seemingly white structures you see here form part of the sacral plexus. And this is our sciatic nerve. So we've been able to, then these vessels, they are gonadal vessels, but we said earlier that this is a female pelvis you are looking at, so they are ovarian vessels, ovarian veins, and ovarian arteries. And this is the ureter. The ureter has 3 constrictions: the pelvic ureteric constriction, this 8th second constriction, at the bifurcation of the internal and external iliacs. The last constriction is as it enters the urinary bladder. Thank you very much for your order. Okay, so look at the structures here. So our pubis symphysis, suspensory ligament of the clitoris, This is the clitoris, the glands of the clitoris. Then you see this structure here, the deep dorsal vein of the clitoris. Now when we come here, the whole thing here is called the urogenital diaphragm, and the urogenital diaphragm is composed of 2 muscles. We have our deep transverse perineal muscle and the urethral sphincter. So this is our urethral sphincter and the deep transverse perineal muscle. And the whitest thing here is our perineal membrane. So let's move on. So labia minora, labia majora, urethral orifice, vaginal orifice, perineal body, external anal sphincter. We have one here, external anal sphincter, internal anal sphincter, and we said that this one is skeletal. the external inner sphincter is skeletal, and these are the internal inner sphincter are smooth muscles. I think that should be all for this.
Add it to show the perineal body.
Okay, so hey, give me the other one. Okay, I'm so sorry.
It doesn't matter.
Okay, so perineal body, come. In this female, it's in between the anus or the rectum and the vagina. So this is our perineal body.